Hi, guys. Thanks for joining. This is Essence of Medicine. Today, we're going to be talking about weird cases in the emergency room. What did you want to call it?
Yeah, they just said your experience in the ER, all the weird things that doctors these days see in the ER.
Today's a full moon, so I want to talk about crazy cases. Not all of these cases are going to be full moon cases. I'm Amanda Armgast.
I'm Dr. Abbasi for Essence, and we have a special guest.
And I am Dr. Austin Beck.
So, Dr. Beck, what's your residency? Where was your residency, and what was your residency?
So I started out, I did a general surgery traditional internship, or just a one-year internship. That was in Bakersfield, California. And then after that, I did 3 years of emergency medicine at the University of Nebraska.
University of Nebraska. Now, I myself as well did actually 2 years of general surgery. And then I did a neurosurgery residency, actually half residency in Germany, half residency actually research in Stanford. And then I did a full residency in Galveston, Texas. So I think if we put our heads together, we will come up with lots of interesting cases. Now, I'm going to tell you first, the first thing that was odd I saw in Germany that makes me actually sad. The reason it makes me sad is because the contrast to United States. One of the weirdest thing or strangest thing or saddest thing I saw in Germany was a young boy, 16 years old. On his birthday, his grandfather was going to take him for hunting in Germany, which is a rare thing. And he shot himself accidentally, yeah. And the thing is that it was like we would call people from other hospital to come and see us, and we say, hey, we have a gunshot wound, come and see it. Because that was such a rare thing in Germany.
Oh,
Not
man.
here.
Oh, man. Yeah.
Now,
very, very, very different.
What I want to say that's the sad part. When I started my neurosurgery residency, general surgery residency first, and then went to the first year's internship, and then neurosurgery in Galveston, Texas, I saw 40 gunshot wounds in the first month.
Yeah.
And
in a single month, you saw 40.
A single month.
Whereas your training in Germany, you only saw
in 3 years,
one.
Just one. Yeah. And that is sad, but as well it expresses, the differences in the overall cultural setting regarding gun and so on. Now, that was a really sad story. It's always sad. But, have you practiced in California and Nebraska? I don't believe the differences in the practice and patient population is that much in California and in...
So California is a very big state, and it depends a lot on where in California you were. So my 1-year internship was in Bakersfield, California, in the Central Valley, where there were a lot of there was a lot of violence.
There is.
There was a lot of violence in the Central Valley, and it was not uncommon for people to get dropped off, having been shot off in the knees. Apparently, the rumor at the hospital was they weren't paying their bills to whatever gang lord mafia people, and that was one of the punishments that was incurred.
So they have to pay somebody, and they don't pay it, and they get a shot in the knee.
That's what one of my attendings one night told me. I am not privy to any more details than that, but it was very common. It was very common.
No, my thinking I'm a very rational person. I'm thinking, okay, Amanda, you owe me money. Now I'm going to shoot you in the knee. How are you going to be able even to go and work and earn the money to pay me back? That's very counterintuitive to me, but obviously not to them.
Yeah, you're thinking that someone who's in a gang is going to be like very rational. Just
so now, did they at least know how to shoot somebody in the knee?
What do you mean know how?
Just point and shoot.
What's the technique you want to teach?
Well, no, there are some ways if you shoot, that knee is gone for good. There are some ways that if you shoot, it still hurt a lot, but they can recover from that in a reasonable way. Like if you shoot through that actual joint and destroy it, these are not people who can probably go and afford a total knee and so on.
Well, I do not think they were approaching it with a surgical expertise in mind.
Analyzing the angle.
So, so it was just a random shoot, or was it in a specific location, or
Usually it was just close enough in that range somewhere. Just
whatever it comes across.
Whatever it was, yeah.
So,
Whatever.
how much do you have to owe somebody to get shot in
That's a very good
Bakersfield?
question. Maybe we should reach out and see if anyone else here knows.
Yes, leave in the comment if you know how much is a knee worth. Now, another thing that I saw in Germany that it happened to me only once. That and that would just break my heart to the amount of the stupidity. Somebody broke into my car in Germany once, and they damaged the car door about $2,000 to steal a stereo. They used to have that then, which was worth only like $150. So they caused $2,000 damage.
Well, they do not care about your car.
No, but as you see that there, the ratio is so out of whack. I mean, come knock on my door. I give you $150. But then, that certainly creates a wrong habit. And one of the things I see as well in lots of things that we see in the ER, unfortunately here, is that same thing could be managed so much cheaper, so much better if somebody put a little brain on it. You don't have to have they come to the ER and use the ER as your family practitioner, right?
Oh,
Well,
for
some
sure.
people-
Overutilization, yeah.
Some people have to because they don't have insurance, right? So then they go to the ER so then they can get treated. Isn't that
Yeah.
what Ali said?
Yeah. My son is actually general surgery residency in California. That ER is for many people is just how they get their any medical care whatsoever. So, but tell me, so Bakersfield, lots of shots in the knees.
Lots of shots in the knees, and unfortunately, there were a lot of other shots in a lot of other places as well.
So more gunshot wounds in Bakersfield than in Nebraska?
Yes. So, to Dr.
I'm
Abbasi's
surprised
point,
about that.
I'm not.
Omaha can be very violent as well, but again, to Dr. Abbasi's point, my first week of nights, so this is when I was a brand new intern.
Mhm.
My first week of nights, I was on the trauma team, just taking the consults as they came in. And we had handoff that started at 6 o'clock. And, the first couple hours are a little quiet between 6, 7, 8 o'clock. About 9 o'clock, we had our first consult that came in. And at that one, I think it was an automobile accident. So we were called down to the emergency room. It was an automobile accident. There were 3 or 4 patients that had mostly minor injuries, nothing very significant. And then about 15 minutes after that, we had our first gunshot of the night. That one was a guy that just gotten shot in the leg. Just this lateral leg, nothing very significant. It was through the soft tissue. No,
Significant to him.
Very much so.
Significant. Yeah. Definitely.
Not life-threatening.
Correct, not life-threatening.
Okay.
Just soft tissue. We were actually able to discharge him. Yeah, nothing.
Same day?
Did you even try, the bullet was through and through, or was it in?
Correct.
If the bullet is in, do you try to take it out?
Contrary to popular belief, you do not try and take it out.
Why?
That is exactly what I was
Leave it in.
pointing to.
Yes. So you can certainly go in and try and take it out. And I've had a couple of people ask me to do that. But again, like in all the Hollywood movies,
Yes.
they make this little tiny incision and the bullet's just right underneath the skin. You know exactly what you're doing. It just pops right out.
And the bullet
And then-
is whole.
It's
It's just
whole,
like
yeah.
go ahead.
And then as soon as the bullet gets out, it's like,
Everything is
safe.
perfect.
It's good now. All right, we're good. We're good. We're good.
Surgery's done.
Surgery,
Yeah.
exactly. And the patient's life is saved.
Yeah.
But no, in reality, it's like you have blood obscuring the field, and you can't see where the bullet is.
Yeah.
So if you think about it, you're taking a scalpel and you're just dissecting through the tissues, just kind of
Randomly,
mutilating it.
kind
Yeah.
of. Yeah.
And you do a lot more damage.
Yeah.
Than if
You
just
know
leave
what
it.
my best movie scene is? Have you seen the movie The Doctor Strange?
Yes.
He's a
The
Benedict
surgeon.
Cumberbatch is the Doctor Strange,
Yeah.
the neurosurgeon. It gets so good. It's so good. He just won the glory, right? This difficult case nobody can do. He goes and start doing surgery, And then while he's doing surgery, the mask is like that. Doesn't even have a mask. Just before he takes the bullet out, somebody comes and put his mask then to his nose to make it more dramatic. And then he goes with one of those pituitary, he goes deep and everybody's quiet.
And it's
And then he
squishing.
takes the bullet, and then pulls it out, and then it comes out. He throws the bullet in a basin with a little blood on it, and then blood splatters a little, and then he scrubs out and goes and
and it's good. It's good.
That
It's
is
good,
so. I was thinking, I want that life. What did I do wrong that I cannot have that kind of practice? But the best part is that he doesn't have a mask. Patient brain is open and everybody's there, but he doesn't. Mask is not even on until he tries to take the bullet out, as if the bullet.
It doesn't matter. It doesn't matter.
Yeah.
They don't have to have a mask on. They're optional.
Yeah.
But if the bullet's out, that's very dangerous.
Now, having said that, though, you cannot believe that I still trained in a place where surgeons, they were treated like gods. They're not anymore. And one of my first teachers in University of Heidelberg, he would used to put his mask this way.
Just right underneath his nose.
No, under the nose, and breathe through the nose.
All over the OR.
Nobody dared. This is true fact.
Yikes.
Yeah, and
Yikes.
nobody dared to tell him anything.
I can't believe that.
It happened. I was there.
I believe you.
I was
but
there.
I can't believe.
There's another story, same place, University of Heidelberg. They're all retired. They're all probably dead, so I can't say the story. Okay, I'm in the second year med school. I know I want to do neurosurgery, so I go and scrub in and so on. And the old neurosurgeon and so on open their locker box, take a bottle of gin, put something in the cap, up, and then put it back. And then he sees me, and I have no idea about anything. Okay? And he tells me, Hamid, always have a shot before the surgery. That keeps your hand steady. And that is true. And that is true because they're all alcoholic.
Yeah.
For them, doing surgery with a little
steady.
alcohol is safer than do it without.
Withdrawals.
Prevent the shaking of their hands. So,
Yikes.
and this is 1984. This is not that long ago.
No.
Well, oh my God, it is. It's 40 years ago. God damn it.
Yeah, you're old.
No, not 84. No, sorry, not 1984, 1994.
Okay,
1990. It's 1994.
Yeah.
Okay? And it's just, they just could get away with it. Okay?
Wow.
Can you imagine that?
Yeah. Thankfully, that hopefully would not happen anymore.
Well, it is, it is not, the gin is not anymore in their locker box.
Right.
And all the bad habits is not in the open.
And it's much more common to speak up when there are unsafe situations.
Yeah, it is. And, the situation is much different for a good reason. But as well, I think, lots of craziness is now just covered. It's not, you don't see it, it's not open, but still lots of craziness is there.
Like what?
Right.
Well, let's talk about our medical experience. Like, okay, we talk about the gunshot wound and so on. What's the strangest gunshot wound you have seen?
The strangest gunshot wound I've seen.
Mm-hmm.
Okay, so I guess going on that first night that I was mentioning, we had I think we'd had 3 gunshot wounds or patients with gunshot wounds who came out on activated traumas, and then our 4th one right after that. This same night, this was my first night working nights.
Four
Oh,
gunshot
your
wounds.
First night as an intern working nights. There was another patient that came in. Well, two people that came in. The guy had actually, or a suspect, a person, however you want to call him, he had actually loaded up a Kevlar vest, and he
was expecting it.
He pulled out his AR-15,
AR-15,
and he walked into a liquor store, getting ready to rob the liquor store, and just totally shot.
What?
Totally shot the place. And the person working behind the desk got a shotgun, and pulled that out and they just started having this war.
Conversation.
Yeah.
Conversation, yes.
Yeah.
Less than friendly fire. Yeah, and that was a very, very tenuous situation. But by the time they actually both arrived in, they're both riddled with bullet holes, just peppered with shotgun spray everywhere, holes in places that it shouldn't normally have holes, and that was my first real wake up call, saying like, oh, this is real, and this is not going to stop. And again, my first night on nights is like this.
What a welcome to medicine.
residency.
Yeah.
Or internship.
How scary,
Yeah.
too.
Yeah.
Because you lived in that city, right?
Yeah,
that you were
I
working?
I did. I lived there. I was married. We'd had 2 kids at the time.
Oh,
Yeah.
my gosh.
Wow.
Yeah.
Wow.
And what's really sad is that, again, people are still living there.
Yeah, but
Of
I was
course,
able to move away, but
nothing's
people are still
changed.
living there.
I have even heard that if they don't finish the person, sometimes if it's gang related, they come actually to the ER or hospital to finish it. Is that true, or is it just an urban legend?
So I have not personally witnessed that, but yes, I've heard the same thing at all the ERs that I've worked
Mhm.
at, and that's one of the reasons why you have to have locked security.
Mhm.
And so you have to lock down the ERs. It has to be a very, very controlled situation.
Yeah. My weirdest gunshot wound was that this guy in Galveston got a gunshot wound to the head. And there are rules to gunshot wound to the head. Like if it crossed the midline, there's really not much you can do. Especially if it doesn't cross the midline and it's not on the non-dominant side, these people still can survive and have a meaningful life. And we got this man who got shot obviously to the right side of the head. The right side is most of the time is not dominant. The left side of the brain is dominant, meaning the speech, the language is still
Correct,
intact.
yeah.
Okay. And he didn't cross the midline. He just, barely, when he was in coma. And his wife was so adamant, let him go, let him go, let him go. He doesn't want to live like that. But say, no, come on. It's just, let's give him a little time for the swelling to go down. We still can make that decision. Let him go, let him go, let him go. 2 weeks later, she got arrested because it wasn't a robbery. It was the wife. She shot him. She shot him.
So sneaky, thinking he doesn't want to leave like that.
Now,
You
same
just don't
thing.
want them to live like this.
Right.
Okay.
Or at all.
Okay. Now, 10 years actually later, no, not 8 years later, I had another patient. It was a motor vehicle accident. Similar thing, injury to the brain, non-dominant side, recoverable thing, and so on. And I was an attending, neurosurgeon attending, and the wife as well wanted to just let him go. He doesn't want to. I say, you know what? I know it's your decision, but as well it's my decision. I'm not going to sign off on this. Find another surgeon or another neurosurgeon who sign off that, because this man, I'm going to fight for this man. Now, this man can still have a meaningful recovery because the damage is limited to the frontal brain. And as we know, people can recover from that to the non-dominant side and so on. And the wife was so adamant to let him go. And sometimes I tell to my friends, be nice to your wives. Because if you're not and you're there, they are going to say, you don't want to live like that.
I was actually just thinking that. Like, I wonder how common that is if it's happened to him twice.
Well, one was a gunshot wound, but that was really thing. The other one, and I was thinking maybe he was just a mean, bad person to her. But that's not my job to. This is a
You can
patient.
be a mean, bad person to the entire planet, and it's still not really
No,
your
but that is my job is to see,
save him.
to do the best I can for him. But the best I can for him is not to let him go because I wasn't ready. And I got in lots of trouble with everybody, including the hospital, because I wasn't signing off. And literally I was there. I told them, for God's sake, this is a Christian hospital. So we should preserve life. We shouldn't, we should appreciate life. And we should be sure that we can do anything I can. Yes, it is definitely family's decision, but I'm not going to sign off on this. I'm going to they just have to replace me. That's fine.
And
I'm
those
not going to be part of it.
And those really are some of the most difficult decisions.
Mhm.
So some of the, like honestly, the most difficult decision that a person could truly honestly face, especially when they're younger and they probably have, I'll say, a slim chance of a decent life afterwards.
But this case wasn't slim at all.
Sure.
It is a non-dominant
So what was the outcome?
frontal brain. No, he started talking about 4 days after.
I bet when that happened, yeah, I bet that kind of made you feel like a little bit grossed out in a way. Not about the patient talking, but about everyone not advocating for him.
Well, there are certain rules in medicine. We know what the odds are. I mean, if it was anything questionable, I wouldn't have fought for that hard, because I did get in trouble for that. But you know what? This is who we are. We do the right thing, and sometimes we just get in trouble for doing the right thing, and that's okay.
Yeah, nothing new or old to you.
Nothing old to me now. But that's by far not the wildest thing I have seen. So let's go.
Okay, ramp it up.
Ramp it up. No,
Your turn.
It's my turn.
Your turn. That is like fighting,
You're one-upping each other.
dance off.
Yeah.
No. What is that thing? Dance battle or something. Story battle.
Story about okay, so fast forward to my first year as I can't remember if I was a second, I think I actually would have been a third year resident in the emergency department. This would have been 4th of July, my third year of residency. So I had just now transitioned into the role of the senior resident, and it was my turn on nights as well, which was because this is the best things always happen at night.
Of course.
So especially 4th of July, everyone knows that fireworks are just wonderfully safe and nobody ever gets hurt.
And they're never a cover-up.
Never a cover-up, and everything just goes off as planned. So I can't remember what time I showed up. Probably like 10. I think 10:30 is when my shift started. No, it's actually a bit earlier. It would have been around 9:30. But we went in there, took handoff, and then it's like, okay, all right, we sit down and we're ready. And right away, first thing, trauma comes in. And so this was actually a pretty sad case. This was a little girl that had been shot in the neck with a Roman candle. And
with what?
A Roman candle.
What's a Roman candle?
A Roman candle it's a firework that launches. I'll call it a projectile. It launches out about 15, 20 feet.
Okay.
It's this firework that shoots out.
Like those, it's kind of like a street firework, right? Like,
yeah.
It's a Minnesota. You know, in Minnesota, fireworks are illegal. The up in the air kind.
No, I didn't know that.
Oh.
The fireworks that they go up are illegal.
Mm-hmm.
Well,
well, you as a company, you can do it.
Oh, I see. Okay.
But not an individual.
So this one was really sad. Again, this is more of, I guess, a public service announcement, like be safe when you use fireworks. But they had set up a bunch of lawn chairs across the street. And they're trying to practice lighting off fireworks safely. But I guess the one firework had started going off, and then the stand tipped over and shot off into the crowd. And it ended up getting her in the neck. And she was fine, I'll say. She had some burns on the side of her face and her neck. But that one was a pretty sad situation. And then the next one that came in was this guy. He was a big, probably 6'5" guy, maybe 350 pounds. Very, very energetic. Very energetic and happy guy. So
Bakersfield or Nebraska?
This is Nebraska. This is Nebraska.
Okay.
So he came in, and the chief complaint was, my arm is gone. And like, okay, all right. So then we get back there, and like he has nothing in his arm. It's just like he was apparently holding his firework, and he was
exploded in there,
throwing it. But before he threw it, it went off in his hand, and there was nothing where his arm should have been. Just this mangled mess of tendons and skin. And as I walked in, I was like, oh man, whoa, what's up with this? And I started talking to people and saying stuff about how his arm was gone and missing. And he was like, my arm, who cares about my arm? Look at my eyebrows, man.
It's kind of cute.
It's like he must have been a Kardashian in previous life. Huh?
I can relate to him. Yeah.
Very pro.
He's not real for that.
My Brazilian butt lift. I paid so much for it. What happened there?
Okay, now your turn. Top it.
Oh my God. Well, I can just tell that Galveston beats both Bakersfield and Nebraska.
Okay.
So I'm going to give you two. You
Okay.
choose which one. We got this sailor in Galveston, and came to the ER with lots of stab wounds. The biggest part of his bowels, the small intestine and big intestine, the biggest part was less than half a foot. That many cuts there. And they have the things that now they can connect this. We ran out of those connection guns because there's something like a gun you can put there. The smaller piece we resected, and those pieces that we have to keep certain amount, and but you put a gun in, you bring two pieces, and you put the stapler, and it connects two pieces together. In that big hospital, we ran out of those guns, staple guns for the intestines. And the best part is not this. The best part is that they told us from the ship he was delivered that he did that to himself.
What?
That is what they told us.
Poor guy. He must have been really going through it.
No, I don't believe that. No, he maybe have done the first one, but he could not have done 30, 50, 60 times.
True.
So I didn't
think
believe
about
that. So that is one. And then same night, I'm going to the room. I go to the room to talk to the chief resident. I'm an intern. And everything's sterile, everything clean, but this stench, unbelievable. Different patient, not same patient.
I was just talking about this story today.
Same story? Did I tell you that story?
You've told me the story multiple
Okay,
times.
so, and literally they have something that look like something that you have this big soup, you serve soups.
A ladle?
What's
Ladle?
called? Ladle. It's like a big, a small, big spoon, really huge spoon. And they're spooning stool out of this person's abdomen in a sterile field. And I'm just thinking, what does sterility means anything here? They just, but you know what? Both of these patients actually survived. The one was obviously in stab wound. The other one was a bowel perforation. And do you know how they cleaned the abdominal after that? They took bleach, just a regular bleach, make it diluted like tremendously, and then they just washed everything out. It seems that the bleach is very, very good at cleaning that situation, but not really that toxic to our own body things. So, the second time I went there, the stench was gone, and everything was much more clear. I had to go there twice, talk to the chief resident.
What happened to this? What happened? Why did it explode?
Bowel perforation. Now, there are certain situations, if your bowel can move forward and go to where it needs to go, it creates pressure, and then eventually they rupture.
So
some after some amount of pressure, they eventually will rupture. What is that? How many centimeter is the danger zone? It's different for small intestine versus big intestine.
I don't think I actually know.
Yeah, for the small intestine, it's about 7 to 9 centimeters. Okay. For big intestine, it's about 10 to 11 or 10 to 12.
Oh, you mean how distant it can
how distant? Yeah. On the imaging, that is what they that makes okay. If it's 4 centimeter, okay, let's keep watching it and so. But if it get to 7 centimeter, let's go to the war and so. Not my field. It's
sorry. I just have a couple questions. So does that usually happen because someone has like a tumor or something like blocking it?
It used to be. Oh, this is a good story.
Wait, before you tell the story, can you answer because
that is what I'm going. So see. It used to be the tumor, the most common reason for this, but now we do so many preventive cares and so on. We colonoscopy and so on, and we capture them. Yeah. But this is new. It used to be that you capture them once it is really there. And there is a thing in Germany they used to call that miserere. It comes from misery. Mm-hmm. Do you know what that is? No, I know we know what misery is, but do you know what that medical terminology means? Miserere.
No,
when they're obstructed to a point that nothing can go one direction, so their stool backs up and comes out through the other end.
Very miserable.
Very
miserable. Yeah.
Well, that makes sense, right? Yeah. And that used to be one of the major things that sometimes you would, and these people I've never seen a doctor and so on, and they come with stool coming out of their mouth, and then you have a bowel obstruction and so on and so forth. Yeah. I mean, very advanced stage of it, but it is either that or they have a bowel perforation and they die. The death rate for bowel perforation is still very high. Educate us, and if somebody really goes through that, the bowel perforation and peritonitis is still a very, very dangerous even today. Peritonitis is when all the organs in the abdomen outside of the bowel have a bacterial infection or something like that it overactivates our immune system, and our immune system actually kills us in a situation like that. Yeah.
Didn't the king one time eat so much that he actually, like, his intestines exploded?
I'm sure it has happened.
Probably several people.
I think
several
That's
kings.
not long ago.
Yeah.
It's one of
Yeah.
my fears.
Yeah. Have you seen any bowel obstruction in the ER?
Bowel obstructions all the time. So going back to different causes, like it used to be cancer.
Mhm.
Cancer was the most common, biggest reason for getting a bowel obstruction. But now with our screenings, that's actually dropped. However, hernias are now the biggest reason for getting bowel obstruction. And so you end up having this like really severe abdominal. Usually what happens is they come to the emergency department. They're having like such a lot of pain in their abdomen. It's like, oh my goodness, this is kind of terrible. Usually they can't pass any gas. They have antibiotic in a couple of days, maybe even longer. And then they're just puking. Everything's coming up. And one of the things we have to figure out is, okay, like, where is it coming from, and why do you have it?
Yeah.
Where is it coming from, and what's going on? Because there can still be other things that can happen, like the bowel can twist around, and it can get stuck in those type of situations. But again, usually it's so the bowel actually goes through a defect in the fascia in the layer in your abdomen, and then it just gets trapped in there, and nothing can pass through.
Yeah.
So sometimes we can actually put pressure on it and do what we call like reduce the hernia. So put it back in place. But if it goes on too long, and if the tissue has already died off, then that would be a bad thing to put it back in. So as an ER doc, I never did that. I called up Dr. Abbasi's son and I said, hey, I need to get on the ER right away.
He's general surgeon.
Come
Not
save
a
me.
neurosurgeon. Not a neurosurgeon. General surgeon.
He's so mad about it too.
Like he's general surgeon, not a neurosurgeon.
Yeah. I think Ali's job is cool.
Yeah, he's going to, Okay,
Yeah,
Ali, it's your job.
It's
It's
cool.
cool.
He does transplants and stuff, so he gets to ride on the private
And
jet.
stuff, transplant and stuff. Okay, now there is something that we don't see it here very often, but in some other countries it's more often. So,
Can I guess?
yes.
Okay, this is going to be so specific. Stab wounds to the head.
Stab wound to the head. Yeah, that is very common in
South Africa.
Really?
South Africa.
Yeah,
Yeah.
so common in South Africa.
I have a good friend, neurosurgeon in South Africa. He sent me all these people, and they all, well, I guess he sees only those that survive. That's why.
That's a lot of
But
stab wounds.
I'm
to the
talking
head
about
that are
like a
surviving.
6-inch blade
Going
and going and stopping right next to clivus. I think clivus is a very strong bone. Right next to it is the basilar artery, which is, if you touch it, you die. Okay, but he has this that goes through the eye, goes right, stop just a millimeter away from basilar artery. No, that is very specific. No, I'm talking about something that is way more common than that, and mostly in the third world country. And that is like, that parasite, these bandworms. Like, if you go on the internet, there's this disgusting videos of bears in Alaska that they're walking with the bandworms, just like a strange, just coming from their rear behind, like yards of bandworms and just walking around. So in nature, it's actually very more common. And in many, the third world countries, it's very common that if they have bandworm as well, they sort of block the passage.
Mhm.
But we don't see that here in the United States.
It's like a water, like mostly you get those parasites from water, right?
Well, the bandworm is actually very specific. You get it from uncooked pork or some other thing and so on. There are certainly things that are related to water consumption, but no, this is specifically to uncooked pork or not enough prepared pork that you get that. And that can be a very, very high number of people who get that kind of bowel obstruction from just the mass of the worm just blocking the passages. Yeah, I know. I bet you didn't see that here.
No, but I did see my fair share of maggots.
Maggots in the what?
In the ER.
No, in the wound.
Just so maggots, I think, are one of the most disgusting, repulsive thing. Like I don't care that you show me spiders, snakes, whatever. I have no issues at all. But maggots and the way that they rise.
Oh, I know.
Okay,
So bad.
But let me tell you something that was discovered. Everybody knows our Gulf War with Iraq, right?
Yeah.
Now, but people probably have forgotten that Saddam Hussein, who was a crazy man, had started a war with Iran in 1980 to 1988, and there were lots of standstill in that war, lots of back and forth, lots of standstill. There were lots of soldiers that they were between, they couldn't get recovered right away. This is actually published. When they got these soldiers after like few days, 10 days, 1 week, those surgeons who had maggots survived. Those surgeons who did not have maggots died.
It's actually interesting. So again, back in the ER, there was a patient that came in the ER. I think this was in late February, so it's still pretty cold outside, and he was homeless and didn't really have the greatest follow-up. About 6 weeks before that, he'd had some kind of an injury where he had broken his foot and was initially treated for that and then discharged. And in that time period, he was lost to follow-up. So 6 weeks, he was out on the streets in Omaha, really didn't have much at all in the way of follow-up care, and also not having the most cleanliness either. Likely, he was discharged with a splint and probably just never even taken it off. And then he came into the emergency department, and he was hypothermic, so he was cold. His body temperature was very, very low.
Was in shock, probably.
Sure, it altered, confused. There's some alcohol on board, and maybe some drugs as well. And you've also got this splint on his leg, and we're like, okay, well, we need to check it out. We need to see what exactly was going on with this guy. So the nurse who was taking the bandage off, she's like, something's not right. Like there's this is just. This something's weird.
Look at Amanda's face.
Amanda's face.
That happens if you bring two doctors here to talk to you about things. It's your fault.
I hope
No. Go. It's getting interesting. Excitement is killing me now.
And so she took the ACE wrap off, and then there was the plaster. Removed that part, and hundreds and hundreds of maggots just down to the floor and the bed, and they just started writhing and just writhing.
What did you do to us? Leave us alone.
I was like, oh,
and they could go so far.
I wanted to grab the bag and just like puke into it, just because like, the way that they writhe. I know. Not natural.
No.
But the wound was clean.
Do you know why though? It's actually proven, and it's now a new method in the management of the wound. Now, what does maggot do? They want to eat.
Yeah.
Who's their competitors? Who's their competitors? Bacteria. Maggots wants to eat your flesh, and they eat mostly your dead flesh. And bacteria want to eat your flesh. Now, bacteria cause septic shock and they kill you. The maggots, they eat the bacteria, the wound stays clean, and you survive. In some areas, there are two new methods of managing unhealable wounds. Put maggots in it. And this is actually, there are papers out there, lots of universities are doing it now. They put in a controlled way certain things that we know, you can order them, you put the eggs there, they hatch, and they eat the dead tissue, and that keeps you alive. Especially if you have something that you don't have the proper bacterial treatment, multi-resistant stuff and so on. There is a second thing that as well, I'm unlucky to have lived through both. And until today, I cannot really enjoy honey because of that. So when I was in Dartmouth College, we had this lady who had unhealable wound and septic shock and so on and so forth, a multi-drug resistant bacteria and so on. So My job was every morning to go and put a quart of honey in that humongous wound under her abdomen, and then clean it up and put a new quart of honey there.
Gross.
And I just recently started eating honey again, just a few years ago, and that experience was 24 years ago.
I'm surprised it even this soon you can still eat honey.
Yeah. But honey is unbelievable in treatment of infection.
So where are they doing that maggot treatment?
Look it up in internet, everywhere doing it now. But it started with the observation that when they extracted those soldiers in Iran-Iraq war, those with the maggot, they survived. Those without maggots, they were septic and died.
No, really, having seen what I've seen in the ER, I would say anecdotally, yeah, it seems to. My experience would support that, and
it's disgusting, though.
Absolutely disgusted with it, but it's true, because I was expecting to see this huge, angry, red, festering, purulent wound that he was probably septic from. But he wasn't septic. He was intoxicated and cold, hypothermic, and that's why he was altered and confused.
But the idea is here, because this is the natural competitor to the bacteria, they actually secrete antibacterial substance that suppress the bacterial growth, so they have more to eat. Here it is, nature, thank you. So if you have a wound in the middle of the desert and there's no other thing, just let the flies sit on it, that may save your life one day.
Good tip. I'll remember that next time I'm alone in the middle of the desert.
Next time you are.
You never know.
You never know. Now, we are getting close, right?
Yeah,
but
you can top it, though. You can.
I can't top it.
I know you can do. I've heard even crazier stories.
Well, I mean, I have been longer in practice probably than you, Austin. So
yeah, but I know for the list you're holding out.
Yeah. No, but so maggots. What about? Is that true that in each ER there is a bin with collection of the things that you guys remove from people's rectum? Is that true, or is it urban legend?
I do not want to touch that box.
So it's a box.
So it's a box.
I do not want to touch it. But I can say that it is full. It is always full.
Oh my gosh, I'd be so curious to look at
it. There are all sorts of sculptures and it's always that somebody fell. And it's
always fall. They all fall.
And
it's like, okay, you're in your garden, you fell on a zucchini. It's like, well, yeah. So obviously you were naked in your garden, because that's how you garden naked.
Most people do it.
Right.
It's healthier.
So it is true. All those stories are true.
Some people. No, as far as the box goes, it is not kept, because that is disgusting.
That's what I was gonna say. It's like, why is there a box? I mean, you can take a photo if you want to.
Oh, you do it always. You have to by regulation. You have to take a photo of it.
Yeah.
Anything that comes out of body, you have to take a picture of it and goes into the chart, right?
That was never on my phone.
So what are the typical things? Zucchinis,
cucumbers,
shampoo bottles,
and I've seen especially like homemade. It's almost like this blown glass. Like it was this like really
blown glass. I'm going to top you off now.
I know this one.
Do you know this one? Okay.
This is the one I was hoping for.
Okay, so again, this person is probably long dead and he doesn't care. But he was the chair of a department in a hospital. And long story short, his wife has to be admitted.
Wait, but what kind of person was he?
He was a very mean person. Very mean person. I mean, he was like, most of old surgeons were used to be mean, but this was like topping them all off.
Specialty.
Yeah, specialty. And then in all the meeting and so on, he would put people down and, he was
a bully.
Well, yeah, bully, but but everybody can be accused of being bully, but he was like actively trying to be mean. It's not like some people are mean like me, and they don't even know it, and they are not really trying it. But well, look at her face. But some people they know they are mean and they enjoy being mean. And so this was that kind of person.
Yeah, because sometimes people like are lacking in some area maybe, and so they have to make up for it by being a bully.
Okay. So, his wife got admitted to the same hospital, and with a wine bottle in one of the places that it shouldn't be. A wine bottle has no business, and the air was sucked out, so the bottle wouldn't come out, and they had to break the bottle to let air in so they can remove it. The thing was, there were 3 other hospitals closer to her home, and she decided to come to this ER. And you can imagine the enjoyment in the whole hospital. That was in Germany, by the way. Okay? The enjoyment in the whole hospital, and everybody wanted a piece of that glass as a souvenir. Wow, I have lots of stories. That doesn't even top of my story. No, it's you go one.
This is a story that my chief resident actually he encountered this patient situation. So there was a patient that came in, and he was complaining of some pain down in his groin, and they started talking about it and saying, okay, like what's going on? And he apparently was playing BDSM with some of his friends. He's like, you know how you play BDSM with some of your friends?
No, we don't know.
No, I don't. But anyway, there was this contraption that
huge what?
There was this appliance, this contraption that was intended to cause more pain the further along that things progressed. And
it's just been so vague. It is just
incredibly vague, because this is like I shouldn't even be telling this story.
No, you should. That's exactly.
And so he's like, okay, he's trying to describe it, and then my chief resident was like, I really don't know what's going on. And so then the kid was like, do you want me to show you? And he's like, yeah. So he pulled it out, and it was this, it almost looked like a chastity belt type of thing that went over the penis, and as the penis became more erect, there's this barb that would go into it that would make it hurt, because this is what this kid was. And anyway, went through the whole evaluation, and it's like, okay, from a medical perspective, he's fine, and
for mental status, probably not.
And then he was discharged, and then later, he had, my chief resident went back in the room, and just happened to see in the garbage, it was that contraption was right there in the garbage. So he thought, oh, this is just so the patient had left it. They thrown in the garbage, walked away. And it's like, okay, so this is just something that we've got to do this. He actually put gloves on, and then he took it. He soaked it in iodine, and made sure it was all clean and stuff. And then he presented it to our program director at the ER residency.
That is very original. That's very original. Very original.
That is so good.
Yeah. No, but this BDMS is real, and we know in our brain how the paths that have pleasure and pain are very, very parallel.
Isn't it cuteness too? Because like sometimes when you see a really cute animal, you're like, oh, you're so cute, I just want to squeeze you. I heard that cuteness and
or I want to eat you.
Cuteness and aggression.
Yeah. They're both amygdala. Amygdala is one of our what's called nucleus in very special part of the brain, which is for anger, but as well for very deep emotions and so on. But we know the same sensory can be seen. Okay, let's have to go way back. Mm-hmm. Pain is a sensory, like animal, like a cow. They brand the animal, so ooh. Then after it's done, it jumps up, goes and starts grazing. It doesn't come back and try to have grudge for 40 years for you for branding that. And it's once the injury is done, move on. In human, it's different. Pain, there's a sensory pain, nociceptive, but then there is an emotional response to the pain. That makes actually 90% of the pain perception in human is that emotional response to the pain. And that's chronic pain is coming from, something that you and I treat. As a matter of fact, I go and give these talks about what is the nature of pain and so on. Now, we know those paths that create that pain. And there's actually part of the brain, cingulate gyrus, that if you lesion it, it separates the emotional sensory of the pain to emotional response of the pain. This patient, they say, I have 10 of 10 pain. Let's go have a coffee.
Yeah,
They
I
separate
feel
it.
it, but it doesn't bother me.
No, it doesn't bother me anymore. Now, those paths are very close to pleasure centers. So the same sensory can be perceived as horrible pain or as the most wonderful pleasure thing. That's what BDMS exists. These people have been training their brain, and once the path exists in the brain, for them, this sensory is pleasure. But you understand that they wouldn't do it if it was the same emotion. If they had the same emotional response to that than somebody else, that like you and I, they wouldn't be doing that.
Yeah, I
Okay.
think it'd be interesting to do a topic specifically on that, because also I think part of BDSM isn't just the person receiving pain; that's the person giving the pain too.
Both areas. Yeah. No, we had as well. Like, a couple of kids actually. They had the small little pocket knife. They pushed on their while they were playing with themselves. They pushed through their belly, and then they got lost of it, and then it actually entered their bladder. That small little pocket knife, and they go with a uroscope. There's a small little pocket knife there. I mean, how did that come to? They went through the abdomen, and while they were doing that, they were just pushing harder and harder, and more pain, more pleasure for them. And that's actually a serious thing that exists.
It can be dangerous.
Yeah, it can be that. Well, it is dangerous. Yeah.
So is that your top story?
No, it is by far not my top story.
So it is.
Okay, well, you want to tell me one more story?
It's your story.
Okay.
It's yours.
So,
He's trying to get out of it.
well, I have two. Both of them are sad and disgusting in a way.
Do you have one that's funny?
It's funny in a way as well. Wait, okay?
Okay.
Yeah, twisted.
So,
Yeah, we'll see.
okay. Now, do you know what is a gynecomastia?
Gyno.
Meaning breast like a woman. That's what it means in a man.
For men, yeah, for men.
For a man, okay? Gynecomastia. Now, there are some hormonal things that make you grow breast.
Mhm.
That's a matter of fact, some men that turn to a woman, they get hormones to exactly do that. In my chief year, the Texas Correctional Hospital is in Galveston, Texas. So every Texas inmate who has medical problem goes there. It's a big hospital. I mean, I'm talking about 8-story, and you go through doors and everything, whole shebang. I mean, it's like the movies, okay? But all the staff on the Galveston Hospital in Texas are actually our medical staff on the Texas Correctional Facility. Okay, we have double privileges and we help them. We do a medical thing. And the weirdest thing you see is obviously on the Texas Correctional Facility.
Of course.
So I'm going to pre-op this patient for mastectomy. And I go there and I start doing the usual thing, and I have to examine the patient. And I'm just thinking, oh my God, the Lord is so wasteful. He has given this gang member with the ugliest person probably you can see in your life, the most beautiful breast you have ever seen. That is, I mean, just imagine, you cut off everything else.
Yeah.
You just look at the breast.
Okay.
He could have been a breast model. And I mean, I have never seen ever anything like that, but I'm surprised he was getting molested in the prison.
He was or wasn't?
He was.
Oh,
That's why he wanted to be removed.
Yeah. I actually thought that this was going a different way.
No, there's
Because
another one that goes
the other
different
one.
way.
I know the other one,
Okay.
and if you told this story first, I was going to tell you
No,
you
but-
owe me
Yeah,
a better story.
well, no, the thing is, and some people were saying he could make a living. He could live like a king in prison
Mhm.
with those breasts. Why does he want it out?
I don't think he really wanted to do that.
That lifestyle.
Yeah.
That's not his lifestyle.
Yeah.
To below a gang member, So the other one, which is sad and disgusting, but as well maybe a touch funny,
This
is
is the outcome. Yeah.
is that this is the patient who had a bowel obstruction, and when you have a bowel obstruction, you know what you do, right? You do a colostoma, meaning that you divert the bowel through the belly with a hole, and you put a bag and you collect the stool and so on. And after a certain amount of time, usually 3 to 6 months, you reverse it. You go back and put it back in. And this guy, for 2 years, always refused to get the colostoma back. You have an idea which direction it's going? Okay, tell me. Yes. You have seen it?
Yes.
So it's not the only time.
No, it's not all about you. Yes.
Okay, go. No.
It's your story. I don't want to.
Okay, no, but the thing is, this guy, for his colostoma, is his source of income in the prison.
Yes.
He's providing service to some other people who thinks that's kinky and so on, to use it for some gratification and so on. And so, but at the end of the day, it was just getting out of hand and so on. So
Was it infected?
Well, usually it's hard to get something like that infected because it's already stool is coming out of it. You know,
one of the things I've seen with that has been that well, first of all, it's not made to be used in that way.
Yeah,
it's not made at all. So where the ostomy actually attaches to the abdominal wall can sometimes actually get ripped out. And you can get a lot of complications from that.
Yeah.
I've seen some prostitutes or sex workers, whatever you want to call it. That was
that. So that is the thing. That is the thing.
So it's like a category.
In its own way.
No, you just blew my mind because I thought that's the only time on the whole face of the planet.
No,
it's very niche.
Oh no, no, it has happened more than once. Across time, yes, much more than once.
Well, thank you guys for watching. So we learned about some crazy ER stories. I'm Amanda Armagoss.
I'm Dr. Abbasi, for instance. I'm a special guest.
Dr. Austin Beck.
Have a good weekend.